Please welcome Ann Jordan, President and CEO of HFMA.
Good morning, everyone, and welcome to AC 26. It's fantastic to see everyone united in this room. So let's begin with some critical housekeeping. As many of you know, we like to start our gathering with a motto: you belong here. This incredible organization grows stronger through every unique perspective and background in it. The most powerful solutions to the challenges we face emerge when people who see the world differently commit to solving them together. The work you do sits at the center of healthcare's future, and none of you should have to carry that work alone. HFMA is here for you. I cherish this room every year. It's a moment to unite on where we are and where we are going. It is our recentering and a renewal. So let's start with where do we find ourselves. You live and feel these forces every day. Reimbursement models are shifting, margins are strained, payment models are transforming but need know-how, policy is in flux, long-range planning is uneasy, and the administration, they are not afraid to make waves and push new behavior for all stakeholders. The workforce is shorthanded, exhausted, upskilling, cross-skilling, and rising remarkably in cost. The population is aging, employers are impatient, and the public is no longer asking politely for transparency and better pricing. They are demanding it with the same consumerism expectation they bring to every other industry that competes for their trust. And what's converging on this industry from the outside? Extraordinary. Artificial intelligence has moved from a future consideration to an operational imperative. It lives inside the revenue cycle, clinical workflow, strategic planning functions, and moving at speed beyond the design of existing governance structures. The returns on the horizon, they're real, as are the risks of falling behind. And the companies building infrastructure, not legacy health IT vendors. Big tech has arrived with cloud scale, data architecture, and AI capability that no health system built organically. And that's before quantum computing rounds the corner to potentially redefine medicine itself. We have a generation of innovators unburdened by tradition and unintimidated by complexity. They are here with appetite and conviction. And PE and VC will follow with outcomes-linked capital and risk-sharing models that rewrite all the rules. All of this. The pressure and the possibility are simultaneous and accelerating with gusto. So last month, HFMA surveyed top executives and thought leaders across all facets of healthcare to take the industry's pulse. We asked whether the US healthcare delivery model had reached or within the next 3 years would reach an existential tipping point. 77% said yes. That's a 23% increase from just 18 months earlier. 90% of those respondents agreed the current system is financially unsustainable. Economic history documents this pattern with uncomfortable consistency. Pressure builds, institutions absorb it until they can't. When the tipping point arrives, it rarely comes as a managed transition. It comes as rupture. What follows reorders leadership, competitive advantage, and the fundamental logic of how an industry operates. Every industry that believed itself too essential to transform eventually learned otherwise. So what does the existential tipping point look like for a fragmented system responsible for the healthcare of 330 million Americans and on a trajectory to exceed $6 trillion in expenditure? That's the weight and the energy of this moment. We are all present for the reinvention of American healthcare. And that reinvention demands financial leadership from this room. For HFMA, on our 80th anniversary, we find inspiration to navigate our future by returning to our origins. We dare to solve. 80 years ago, 16 people sat down in Bloomington, Indiana, and decided someone in healthcare needed to make sense of the money. That was the birth of HFMA. The world they were organizing had almost no rules, no standards, no shared language. Hospitals ran on faith, community goodwill, and cash, in that order. The system around them had hit its own version of an existential tipping point, hollowed out by the Great Depression and then World War II. Half of US counties had no health facility. Prolonged illness meant financial ruin. And the national debt to GDP ratio was 122%, mirroring what it is today. Mere months before HFMA formed, President Truman stood before Congress with a plea and a vision to resurrect US healthcare from the edge. We should resolve now that the health of the nation is a national concern, that financial barriers in the way of attaining health shall be removed, that the health of all its citizens deserves the help of all the nation. Timeless words. Congress delivered half of what he asked, decoupling research and infrastructure funding from his failed push for universal insurance. The Hill-Burton Act directed the equivalent of $109 billion in today's dollars to 3,500 hospitals and thousands of facilities. And in exchange, it required those institutions to provide free and reduced cost care to uninsured community members, our seeds of charity care. By 1968, that investment had financed over 9,200 medical facilities across the country. So back to our 16 courageous souls in Indiana. The HFMA founders were formalizing a profession out of chaos the exact moment the federal government began demanding that hospitals behave like accountable financial institutions. Without people who could manage grants, track uncompensated care, plan capital projects, and report to regulators, Hill-Burton would have collapsed under its own administrative weight. HFMA's founders were building something in response to disarray and the unknown. They believed that financial clarity and structure in healthcare was an evolutionary pathway, not a destination. You see, the numbers were never the point. The numbers were how you got to the people, to the community, to a healthier and stronger nation. Organizational theorists have long distinguished between two responses to systemic failure: fixers and builders. Fixers pursue stability. They optimize what exists. They make current systems perform better within their own logic. They bet that the existing structure can produce a different output if managed well enough. That's a reasonable wager until the structure itself becomes the problem or innovation cannot be contained. Now, builders, they start from a different diagnosis. They look at the same pressures, the same constraints, the same data, and conclude that the path forward runs through transformation. Because under the current operating model, they don't believe stability, growth, or innovation can be achieved. Capital that bets on builders is making a different wager, that the system is changing, and the returns, financial and human, will reflect who shaped the transformation. That distinction has guided HFMA's strategic logic in dynamic times all the way to 1946. That's why, a year ago on this stage, we announced Vitalic Health. Vitalic Health is a four-part business model and movement built on a simple premise. No single stakeholder can solve what every stakeholder helped create. It brings together providers, payers, employers, technologists, policymakers, and investors to a shared commitment on affordability, financial sustainability, and better outcomes. The critical interconnectivity between these three components, affordability, financial sustainability, and outcomes, warrants our full attention. In particular, a few years ago, let's be honest, affordability might not have made the agenda for this event. But the environment is changing swiftly. Let's return to the pulse survey. 100% of our respondents agreed their organizations must share in the responsibility to make care more affordable. Complete unanimity on a complex question, and that's something that should move us all. And yet, only 53% believe the system is structurally capable of returning savings to patients. That same percentage believe any savings simply disappear into the system. So an incremental fix to that storyline seems a bit out of the question. Gallup now ranks healthcare affordability as the #1 domestic concern in America. And it has become the place where the system's contradictions are most visible. Families ration medications, they defer care, they make trade-offs that compound greater cost and greater harm down the road. Trust simultaneously erodes, and providers absorb the frustration of a payment model and system they did not design and they cannot unilaterally overhaul. Progress in this area has stalled in part because we've never truly agreed on what we are solving for. Affordability shifts depending on where you sit, and it has long been defined by whoever held the most sustained presence in the room. Providers and purchasers have rarely occupied that room with shared purpose. That is a gap worth closing. And exchanging smear campaigns in the Sunday news, or relabeling decades-old lobbying campaigns alongside a sudden epiphany for affordability, that won't be helpful. The complex, frustrating gap between system expenditure and the outcomes the US population experiences has a name. We at HFMA and Vitalik Health, we call it the affordability paradox. This year, after public comment period, Vitalik launched its first major offering, the US Healthcare Vitals Tracker. The tracker is a comprehensive, transparent framework measuring the system's affordability and its capacity to meet present and future demand. A shared, data-driven foundation for an honest conversation about the system's condition. Beyond a sobering composite score and serious condition rating, the data overwhelmingly exposed a clear trend for the last 25 years. By nearly every measure of medical capability, this system has never been more advanced. We diagnose earlier, treat conditions once considered untreatable, and extend lives in ways unimaginable a generation ago. The science is extraordinary, and it truly deserves our celebration. And yet costs rise, access worsens, the population is not living longer or healthier lives proportional to what we spend. There's no reliable relationship between what we invest in the system and the outcomes we produce. That's the paradox. And the public, they're living inside it. Financial sustainability, now that's where the paradox becomes institutional. The cost of care is structurally complex, and payment models have historically amplified that complexity rather than resolved it. No professional community understands the mechanics of that more precisely than this one. That knowledge, it carries obligation. And HFMA, we do not admire problems. In the year ahead, we're moving on 3 fronts. We will advance the payment model consortium of Vitalik Health, a dedicated platform and effort to accelerate the transition from volume to value, from sick care to preventative care. It will meet organizations at their contract and risk management level and build deliberate pathways to accelerate value-based care and greater sustainability. We will deepen our commitment to optimizing transparency to the total cost of care delivery, driving shared understanding and best practices across the system with rigor this topic has long deserved. And we will drive administrative simplification and standardization efforts to modernize healthcare financial management. 83% of our survey respondents said the lack of standardization is a greater barrier to sustainability than the complexity of care itself. Not the science, not the politics, our own failure to organize. US healthcare spends just shy of $1 trillion annually on administration. At least a quarter of that is recoverable waste requiring no federal mandate. What sustains it is the payer-provider divide and self-interest. Complexity concentrates leverage with whoever has the infrastructure to manage it. And not every stakeholder at the table is equally motivated to see that change. To this point, when our expert pool was asked which factor of economic alignment most strongly drives costs upward, the dominating response was misaligned incentives among providers, payers, and employers. It's also the wall that AI and automation run into directly. Standardization is the infrastructure that makes automation work at the collective level. Without it, we're accelerating down a dead-end road of proprietary silos. The historical precedent is clear. Industry leaders who self-organize first, particularly in finance, produce better standards faster and at lower costs than those who waited for government action. Providers who seed this conversation will find themselves standardized against their own interests, and in this area, we must be builders. Over the next days together, it's worth asking honestly, very honestly, whether our strategies are genuinely shifting to connect financial sustainability of health systems with affordability the public demands. Because in many respects, those two things are part of the same wound. You cannot achieve provider sustainability by shifting costs to patients who cannot bear them. And you cannot achieve patient affordability by dismantling the operating models of the institutions that care for them. The most courageous act of leadership available to us right now is to embrace this moment of reinvention and to envision something demonstrably better. Financial health at the institutional level must align with financial health at the human level. These are not competing interests. And the leaders who design and build for that alignment deliberately, they will define what this industry becomes. The survey data points I've shared today are featured in a new Vitalik Health report on healthcare affordability, and we're going to release this nationally when this session concludes. Our work now is to move the conversation from general agreement to shared accountability, and from shared accountability to action. That is what Vitalik exists to accelerate. And I invite every person in this room to join us, to dare to solve. Because for 80 years, that has always been HFMA's work at its best. I want to thank the board of directors, including our new chair, Matt Cox, for their incredible leadership over this organization. I want to thank the incredible HQ team for all they do to support the members and to support me every day. And most importantly, I want to thank you for being members, for for being a part of this conference, for the critical and demanding work you do for your organizations and communities, and for your willingness and optimism to build a better system together. Thank you very much.